difference between what we call airborne and what we call droplet. Airborne, as you can see, they're bigger particles, and you can kind of think about 5 microns as being about the size of a hair follicle. Those are full of RNA, and that's what the virus is. It's a certain type of RNA. And you can see those come out and then they kind of drop, whereas the airborne particles are much smaller and they can drift a little bit further. So if I'm standing, say, 6 feet away from Father Ian, and I cough real loud, or I start singing, or I start yelling at him or something like that, then those viruses are going to come out, but they're going to drop just about within 6 feet. Whereas if I do a certain procedure, say like if I have asthma and I do a nebulized a treatment, and the particles are much smaller and they actually go up into the atmosphere and become almost vaporized, then that can go a little bit further, and it might go further than 6 feet, but that's in particular situations. Next slide, please.
So, Doctor, I have a quick question for you. As we were first talking about, you were talking about the droplets. So really the concern is not just speaking or just pushing air out, but if there's droplets attached to it, basically, right?
Yeah. So
like at this point right now, even though we're in the same room, there's not a lot of us in here. There's 3 of us. It's a bigger space. Droplets aren't going to travel as far, so we're fine not wearing a mask, right?
Theoretically, they wouldn't. And yes, in this situation, it is probably more likely that you're okay not wearing a mask than if you are wearing a mask. What I would advocate, if you have any concerns, wear a mask. Certainly, as you mentioned, if you're closer together or you're in a smaller area, absolutely. But to your point, you and I are about this far distance away. I don't know if you could tell that out there, but we're about 2 arms lengths away. That's approximately 6 feet. And you're exactly right. If I'm just sitting here talking, not in my animated, crazy tone, but just normal, some of the particles are going to come out and going to fall. And it's not exactly how much, but how much comes out and how long you're exposed to it.
Yeah.
If we're sitting here and we're talking for hours, you're probably going to get a pretty good load of that if I'm infected.
Okay.
If I'm infected. Which goes to the big point. If you have symptoms and you're sick, stay at home. That's what's important about